welcome to another sensitization program on COVID-19. This is the National COVID-19 Sensitization Program that comes your way daily on all television platforms, of course, commercial radio stations and community radio stations being held here on GRTS. And as I said, aired on all private TV stations. You will find this aired right now on Paradise TV, iAfrica TV, Star TV, and of course QTV, and of course GRTS itself. Joining me in the studios are officials from the Ministry of Health to discuss a very important topic for today, which is going to be the state of preparedness of the COVID-19 vaccination. This is a very, very, very important topic. It is a thematic area that we're going to talk about today with health officials. In our previous program, we discussed about non-pharmaceutical measures, measures that you should take to prevent or protect yourself against COVID-19. And the second thematic area today is going to be on state of preparedness of COVID-19 vaccination. But before I go any further, I would want to inform you that on all television platforms, you will be watching this program. On all commercial radios and, of course, community radios, you will be listening to this very, very, very important program. So stay tuned. Now, I will first of all want to invite my panelists on my immediate left, who is from the Ministry of Health, to introduce himself. Then we go into the program.
Yeah, good evening, everybody. My name is Mbai Njai from the expanded program on immunization and as the senior surveillance officer on vaccine preventable diseases.
Good. Thank you very much, Mr. Njai. Welcome to the program. On my immediate right.
Thank you very much, Mr. Njai. Good evening, viewers. I am Lamin Sise. I work with the Ministry of Health and under the expanded program on immunization, responsible for coordinating all the immunization-related activities in this country.
Good. Thank you very much, Mr. Lamin Sise, and welcome also Mr. Mbai Njai, both from the Ministry of Health. And I'm your host for this program. My name is Momodu Njai. Viewers, as I just earlier mentioned, our topic for today is going to center on state of preparedness of COVID-19 vaccination. But before we go into the program proper, I just want a Ministry of Health officials to just give us a reminder of some of the preventable measures that can protect or minimize, the chance of catching COVID-19 before we go into the actual topic itself. Mr. Njai.
Yeah, thank you very much, my colleagues here. The first thing that we will advise people to do is to ensure that wear a face mask. Mm-hmm. That's number one prevention. Always wash your hands with running water and soap, and then also avoid crowding, which means social or physical distancing. Okay. These are the 3 W's that we definitely want people to treat, issues that we want people to take note of and to be practicing this. And then if we do this, I think we will definitely reduce or minimize the risk of transmitting or catching the virus.
Exactly.
Yeah.
Mr. Sise, give us a reminder, because some people are still of the belief, there are a lot of myths and misconceptions here and there, that COVID doesn't exist in the Gambia. Is this for real? Do we really have COVID in Gambia?
Yes, actually, Mr. Njai, we do. And something that has to related to somebody's perception of behavior mm-hmm. is not easy to change mm-hmm. or convince. But I think that's why we have the risk communication and community engagement mm-hmm. from the Ministry of Health with partners. Mm-hmm. I think definitely COVID is definitely real. If you look at economies of the world have been grossly affected. In fact, look at the tourism now. Exactly. We should have been definitely receiving a lot of tourists by now, but you can see airports closed. A lot of trades in terms of world market has been closed. So definitely people are even dying. That's why from the situational report, you can see the prevalence and at the same time, people dying from COVID. So exactly. We're appealing to everyone to definitely understand that COVID is real and it's within the Gambia here. So let's take it seriously.
COVID is real and is within the Gambia here. And let's take all preventive measures to prevent oneself and the community, and of course your own very own family from the risk of infection with COVID-19. Now, moving further to the topic, which is going to be on state of preparedness of COVID-19 vaccination. I'm sure a lot of people, everyone watching this program, have heard about the availability of vaccination in some parts of the world. But let's talk about the Gambia. What is the state of preparedness as far as the COVID-19 vaccination is concerned?
Yeah, as we speak right now, the Gambia submitted, the first thing we did was to submit our vaccine request. We have what we call the COVAX facility. And then it's partnered with by WHO, CEPI, this is the Coalition for Epidemics and Preparedness Innovation, and also Gavi, the Vaccine Alliance. They form what we call the COVAX facility to ensure that like developing countries will definitely benefit from the vaccine, because we know that like once the vaccine is out, everybody will be rushing for the vaccine.
Exactly.
We want to ensure that like developing countries like the Gambia, they benefit from the vaccine. So we sent our request so that they can also support the Gambia in terms of allocating vaccines. This has been done already, and then after that, you definitely need to develop what we call the deployment plan, and vaccination national vaccination deployment
let me cut you short there. Before we go to the deployment plan, now you want to inform people that actually Gambia has taken the steps to acquire the vaccinations.
Yeah, now Gambia has taken the steps, and then like Gavi has allocated some vaccines for the Gambia, which is almost about 180,000 doses of vaccines which have been allocated so far. And then because the COVAX facility is providing 20 vaccinations to target 20% of country's population. We know that like if we take the 20% of the population is going to, for example, the Gambia's population is about 2.4 million. We're expecting to have about 480,000 doses. And then so far they've allocated the first tranche. They've allocated so far 180,000, which we expect to receive before the end of this month or later.
That was going to be my next question, actually, because when viewers hear the issue of vaccination and the doses, they really want to know when Gambia is going to have these doses in our very own land.
Yeah, we're expecting to have this. We just because it follows procedures. You definitely need to, after sending the request, your allocation is done. There are some documentations that the country need to follow. That one of them is to ensure that you submit the NDVP, National Deployment Vaccination Plan, and that has been submitted. And then also like you sign a document with them called the indemnity form, with the manufacturer. As we speak now, that one is being signed, is to be signed by the Honorable Minister of Health to be sent to the manufacturer of the vaccine. And then from there now they will start sending the vaccine. And so far we have submitted all these documents. Waiting for the minister. The minister will be signing, sending this document to the manufacturers to send in.
So at least within a month or two, we expect to have the doses around.
Yeah, we expect to have the doses. Our plan is to have it by April. That's our plan. Inshallah.
Let's pray even before April we have it there.
Yeah. Before April we have it in. Yeah.
Let's hope for some divine intervention.
We have a lot of engagements going on, and also definitely partners are also supporting to ensure that like these vaccines, like WHO, UNICEF, and the World Bank, they are definitely supporting the country to ensure that like we get these vaccines in the country.
I think that's quite reassuring that Gambia is en route to getting the vaccination or doses at least before April. And now let's move on to the state of preparedness in terms of deploying the vaccines.
Yeah, vaccines are definitely living life items. They definitely need to be stored at definitely required temperatures. And then like the country has now, we have all the necessary equipment that we need to store these vaccines on all the respective health facilities, public and private health facilities. Especially the type of vaccine that we are coming to, that they allocate to us is the AstraZeneca vaccine. And then that one is within our normal temperature, 2 to plus 8 degrees. So in terms of receiving the vaccine, we are really prepared. We have a national quorum. I think the logistician will come into that. And then like he will definitely emphasize on the storage conditions that we definitely have across the country.
Mr. Cisse, I think it's a good point that you will need to add up.
Yeah. Thank you very much, Mr. Njai and viewers. I think coming to the state of preparedness in terms of deploying the vaccines, we think of vaccines, where to store them. I think this is very essential. One good strength or one advantage we have over other countries is that all the public health facilities are equipped with solar-driven fridges. So meaning even without electricity in the remotest health facilities, we are able to maintain the potency of these vaccines. Safe and secured. So meaning we already have RCW50. Those are type of fridges that we have in public health facilities. And of last year, we also have what we call the CCEOP, Cold Chain Equipment Optimization Platform. Is a platform that we applied, and thank God we passed, and we have already installed 80 equipment at regional facilities, at regional level, and also in all the public health facilities. So meaning they have backup fridges. So now, as we speak now, you have a lot of vaccine candidates in the market. But we also looked at which one will definitely suit the Gambia in terms of storage, and which one are we ready to accept. Because they said you never change your winning team. At health facility level, we always keep our vaccines between +2 to +8. Now, one interesting thing that we would want the viewers to know is that vaccines are very, very delicate commodities. So those are the health facilities monitor them in the morning and in the afternoon, meaning they have to monitor their temperature. So the vaccines must be kept between +2 to +8. So anytime they are beyond those ranges, it's definitely a cause for concern, and you need to report it to the relevant authorities. So as we speak now, if we already going to, as Mbai said, to be allocated with 180,000 of the AstraZeneca, and that is going to be kept between +2 to +8. So even if we receive the vaccines today, clear them from the airport, we are able to definitely take them to regional stores and also to the service points throughout the breadth and length and breadth of this country.
Good. Now, you've spoken about the vaccine, which is AstraZeneca in your health terms. Have you looked at the quality of the vaccine for before deployment?
Yeah, Gambia, we do not have the facility, for example, to test the vaccines. Well, what we really rely on is WHO. And then WHO definitely needs to approve a vaccine before the Gambia uses it. And then that's what we are definitely following. Before we even we went in further, we had to delay some of the issues to ensure that like WHO gives an approval, or if the other required measures are not taken, we will not definitely, WHO will not approve any vaccine.
Of course, with a set of rules and guidelines
and benchmarks that are definitely need to be reached. And then as we speak, as of last week, we've received communication like the WHO have given, have approved the AstraZeneca vaccine to be used as emergency use listing. So for example, if they do not go into the pre-qualification, because it takes a long process to pre-qualify a vaccine, but because of the urgency and also the need for the vaccine to be rolled out quickly, WHO also have rapid measures to give emergency use listing for certain drugs or certain medical items that countries can definitely rely on and use. So that WHO has definitely done, and then that's why the Gambia is definitely going in for the AstraZeneca vaccine.
Good. Now let's move to. We've talked about the state of preparedness of the COVID-19 vaccination, but I want us to touch on also the target groups for the vaccination.
Yes, the target group, this is globally, I think target groups are definitely challenging. We definitely, COVID-19 is not sparing anybody. And then everybody is at risk, but there are people that are at highest risk. And then these are the health workers who come in contact with people.
I think this is where the sensitive issue is.
Yeah, that's where the sensitive issue
now
is.
we're talking about the vaccines, hopefully getting some time around April or thereupon.
Yeah.
But we're also talking about health workers putting themselves in the first line.
Yeah, serious. So that's
Yeah.
it, and then
Yeah.
it's going to serve as it's going to have two purposes.
Okay.
Firstly, is to protect the health workers so that
First.
they will be able to take care of the sick
Yeah,
people.
and these are the people
Yeah,
who have the
that's what-
direct
yeah,
contact
direct
with
contact,
patients.
especially
Yeah.
frontline health workers and
Yeah,
all those things.
exactly.
And secondly, also, like, if health workers take the vaccine, they will know that, if it is not
Yeah.
safe, why would they take it?
And of course,
So
I believe
definitely-
that will give them even
yeah,
some safety to go to
the
work.
yeah, definitely. And then those are some of the things that where the health workers would definitely be first prioritized.
Okay.
Then later on we'll go into the other priority groups, like you have the high risk group, like for example, like those who have comorbidities. And also like the security forces, for example, because they are also frontline health workers.
Of course.
Okay, we'll also come to you people as
Of course.
journalists. Also,
I was waiting for that point.
No, I would
We are equally at high risk.
Hoteliers, those working at the hotels,
Okay.
those are definitely our priority. We have
Generally people who do public service.
Yeah, definitely. And
other,
then we have what we call
private
the
services
National
related to the
Immunization
public.
Technical Advisory Group.
Okay.
That's an expert committee composed of about 15 people, more than about 15 to 18 people, professionals that are definitely public health experts, immunologists, and then also pediatricians, physicians, laboratory microbiologists, and of every sector of health is represented in that group. And this group is now working has worked on the prioritization, and then try to see who is at risk and whom do we prioritize from where from this group, whom do we vaccinate next.
Good.
So
I think that is very,
that.
very, very, very important, because once you talk about vaccination here and doses are here, everybody thinks that I am entitled. So it is very important that you clarify that point, that this is about a priority, basis, that we are going to prioritize A from A to B to C, and it goes on like that. Otherwise, there will be chaos. There will be serious chaos. So it's important that the right message goes out there for the benefit of every Gambian and non-Gambian resident in the country.
Every Gambian is entitled to it.
Exactly.
But everybody will get their turn.
Exactly.
For example, like so far, we've seen that like most of the vaccines are not effective against children below the age of 15 years.
Okay.
So you see that like we are not targeting them. But like anybody above that age, because if you look at the Gambia's population is small, so with, from the COVAX facility, which will take care of about 480,000, the remaining population group, the remaining number would be definitely about 900,000 people will be supported from the World Bank and then they will definitely procure those vaccines for the country, and then they will definitely vaccinate everybody.
Good.
Yeah.
Now, what does that mean for children now?
So yes, so right now there's still research going on, and then there as we get more insights of the efficacy of the vaccine, because you don't want to give it to them and then it becomes a wasted resource. So and then you know that like it's effective again on all the population. So we definitely try to ensure that we give it to those people that we are sure that it's effective, and then vaccinate those ones. And then if the children are there, what we encourage is like we still as adults we still continue to protect them.
Exactly.
Like ensure that like they put on face masks. We the adults also, as we put on face masks and then vaccinated, we are the ones who frequently go in and out. If we are protected, we will not be coming with the virus in the house. And then also children also practice hand washing and also physical and social distancing will definitely.
I think that is very important, looking at the fact that children commute every day to and from school, and also assemble in schools and other educational facilities.
The other target population that I forgot to mention is the teachers at the schools.
Of
So
course.
also
I believe in fact they are frontline workers.
Yes, they are definitely going to be part of the
want to
priority
advocate for that.
Yeah, seriously. They will definitely be one of the priorities that we definitely vaccinate after the health workers.
Good. I think fair enough. Now I want us to move to the issue of vaccination strategy. What vaccination strategy is in place?
Okay, thank you once again, Mr. Njai. I think, as I said, we don't want to change a winning team. As I said, vaccination campaigns are not new in this country. In fact, this will just remind me to reflect back on the EPI program when it started in 1979. As we speak now, we are giving out 13 vaccines to children and also to pregnant women. So you can understand that we have a system in place where we have 3 tiers in this country. You talk about the central, regional, and health facility level. Okay. Now, coming to the strategy, we still want the regional people to support the health facility level where they will go down. Each health facility have what we call catchment area. So they will be operating within their catchment area to give out this vaccination. And the sites would be, all public health facilities will be fixed sites where teams will be stationed there to give vaccines to the target beneficiaries. The other strategy we want to do is a mobile teams that will be moving to go and be at strategic places. Ferry crossings, bantabas, this will be done in line with the regional health management team and of course communities, where they would say these are places where people could be stationed and they will be giving out vaccine. So we know terminals and other places, I know it will be challenging because the vaccines definitely, we know we don't have enough of the vaccine. You think about 180,000 doses for a go, it's just a small number compared to the target population. But I think government is also fairly doing well to make sure that at least 2-point-something million of the population receives. But of course, in terms of priority, we have our scale of prevalence where we started with the most urgent ones or the priority ones. So the strategy in all public health facilities, this will be an information to all public health facilities. Anytime the vaccination starts, a team will be stationed there. And also we will have strategic locations within the communities where we will have team stations there. So let's say for Bansang, where they have their operational area where routinely they go out. So the same strategy would continue, where when they finish one community, they move to other communities. This is where, in terms for the target population, it becomes quite challenging now, whereby it talks about those with comorbidities. How do we identify them? So it means we have a big task ahead because who is there to say, I don't have diabetes, I don't have hypertension, and so. So it means the health facilities have a lot of work together with their regional supervisors, and also the communities also, because if everybody wants to come out, it will be chaotic and we may not be able to do what we expect to do. So we are also appealing to everyone to understand that it's a priority for the government to make sure that every citizen in this country is vaccinated. Because what we're trying to do, there is a term in health we call herd immunity. If majority of the population are vaccinated, then the others who are not vaccinated, the non-vaccinated population will be definitely protected because the virus cannot move from the other one to the next guy.
Now, that is very important, but I just want to clarify this. Is the vaccine going to be rolled out throughout the length and breadth of the country, of course, with priority for target groups?
Exactly. I think this is where we also, there is a technical working group. Every Wednesday we meet, you have partners from MRC, Gambia government, and other stakeholders. We come together. I think we definitely want to say, yes, all the health workers within the country needs to definitely receive because they will be giving first. So we are also thinking there is something in place we call micro-planning, meaning we have to strategize with the regions to make sure that we prepare very well. Who will be the first, even within the priority, we will still have to prioritize.
In each of those regions.
In each of those regions.
And I think this is where you need the participation of religious leaders, not only health workers, but political leaders, religious leaders, traditional leaders.
If you look at the plan, I talked to you about the National Deployment and Vaccination Plan, it goes along with a package. And the package look at the community sensitization aspect of it, where we talk about, in fact, at regional level, technical advisory committee, where regional governors will be very key. You have chiefs coming in. The opinion leaders will also coming in. We expect them to go back to their grassroots communities, talk to people about this vaccination so that everyone is aware. We're also targeting the faith-based organizations, the Gambia Supreme Islamic Council and the Christian Council.
Of course, using the imams and pastors, I think they could be very effective looking at our congregational prayers, disseminating information there. The right information will be very crucial to use these imams.
So those are some of the social mobilization strategies we would want to employ before the vaccination start. So we hope people will understand because it's different from other vaccination campaigns. A pandemic came prior to the vaccination. So everybody would definitely rush in for the vaccination. But I think with people understanding how we are moving and let them understand our overall aim is to make sure that every Gambian or everybody living in this country is protected. So I think so far so good. as we move, we will be unfolding things to the community so that we are all on the same wavelength.
We all on the same wavelength. But let's talk about the dosage. What kind of dosage are we expecting? And the schedule of the dosage.
Sure. As we speak now, we are sure of getting 180,000 doses from Gavi. Gavi, they are the vaccine alliance, and they are our main partners in terms of even routine vaccines.
Okay.
Gavi, even for the new vaccines, for every $1, they spend about 80, and the government buys 0.2 cents. That's 20 cents. So you can imagine, but for the traditional vaccines, government provides them. Now, Gavi, as they provide the 180,000 doses provided, but for the AstraZeneca, because you have other vaccine candidates too. Pfizer is one of them, Moderna, Johnson & Johnson. So a lot of vaccines are there. But as Mbai rightly said, we have what we call National Immunization Technical Advisory Group. They are expert committee that helps the government to take crucial and strategic decisions in terms of vaccination. So as we speak, the 180,000 doses, once you receive a vaccine, 4 weeks later, that is 1 month, you are supposed to receive your second dose. Exactly. We've seen in other countries. So it means we must keep a record or track of those who received the vaccine for the first dose. So we are trying to put an electronic...
So it's 2 doses that one is supposed to receive?
Yes, for the AstraZeneca, as we speak now, 2 doses. But any vaccine candidate that we receive, health workers will, of course, be trained prior to any vaccination. So once they are trained, those technical details will definitely be clarified to them, and they will be able to, as they go into the vaccination site, they will be able to do according to this prescribed doses by the manufacturers and the schedule.
Yeah. Now we've heard you've mentioned about 180,000 to be vaccinated.
Yes.
What does this figure imply? Does it mean you're going to take it twice to qualify for each one, or is one individual going to take it? What is the statistics here? Because if you talk about 180 and you're going to be vaccinated twice, then you're talking about
90.
You're talking about 90 here.
Yes.
So that means, in actual fact, is it 90,000 or 180?
Yeah, actually, this is what Gavi has allocated for us.
Okay.
That this is the number of vaccines that they guaranteed that they would give, maybe end of February or early March for us to, and this will even be in 2 shipments.
Okay.
So once we receive the first shipment, we would be able to know exactly now, the health workers now, let's give them 1 dose. Because for vaccination, you must go by the prescribed dosage of the manufacturers. Some of the vaccines, you just have a shot and it's the efficacy. Yeah, that's it. So, but for some, if the dosage is 2 doses, probably for people to be protected, you must definitely give out 2 doses. So at least 2 doses. So as we speak now, since we are prioritizing, but what is the biggest challenge is how do we track people who are vaccinated? In previous campaigns, we definitely give them vaccination cards. Exactly. Sometimes for kids, we will have to mark their fingers. But imagine for 1 month, would they be able to keep the vaccination card? So we are trying to come up with an electronic system that will be able to track those who receive. If Mr. Njai comes, yes, Mr. Njai, you receive, and your biodata and everything.
To avoid repeated cases of people being
so
given
that's
the
plan,
doses. I think that's quite very clear. But I want us to look at, Mr. Njai, the issue of vaccination safety. What message do you have for that?
Yeah, vaccines are not just rolled out without proper testing. They definitely need to reach certain benchmarks before it is rolled out, before the WHO gives them at least approval or emergency use listing. And then the vaccine is a safe product. Vaccines have definitely been working for centuries. And then if you recall, most of our elders will recall about smallpox. It's eradicated as a result of vaccination. Right now we have polio eradicated in Africa. It's as a result of vaccination. So this vaccine also is very safe. It's, although like people will say it's very rapid, because like they definitely put in a lot of resources, because like pharmaceuticals would definitely used to fund this vaccine research on their own. But this, because it's a global need, so a lot of efforts have been, a lot of funding, over billions of dollars have been pushed into the vaccine development. So that's why it is very rapid. And then they definitely, one thing that we are not compromising is like safety. okay, safety measures before any vaccine is approved. The safety data have to be given to the WHO, and then they will review and then try to see what are the issues that are arising from the testing. So these are some of the things that have definitely been done, and then it's safe to be used. And then other countries, we have seen them, they are giving, so many people are receiving the vaccines, and then they are definitely safe. And then there are just minor, because like there is nothing that you do without any minor, any sometimes you may have some effects. For example, like injection pain at the injection site will definitely be there, because you are causing an injury into the skin and in the muscles. And then also like fever will definitely come in. And also sometimes there are different individuals who manifest different effects, but those are minor things that we have definitely seen so far. So what we got telling the population is that the vaccine is safe and it protects against the COVID-19. So I think that's the most important thing. Even though like I may get those pains and all those things, fever and all those things, but like it's going to prevent me from getting the virus is something that I would definitely advise people to go in for.
It's something that I will definitely advise people to go in for. If you're just joining us now, this is the National COVID-19 Sensitization Campaign aired on GRTS and, of course, on all private television stations, Paradise TV, Star TV, iAfrica TV, and, of course, QTV, and also on the commercial radio stations and community radio stations, meant to sensitize the general public on issues related to COVID-19. Last topic we had on television was on state of preparedness of COVID-19. This is our present topic for this program. But the last program we discussed about non-pharmaceutical services, which included myths and misconceptions related to COVID-19. And health officials have confirmed that COVID-19 is real. It is no joke. People are dying from COVID-19, and it has to be taken very seriously. We also discussed on the non-pharmaceutical services measures that one has to take, including me and yourself, to mitigate or reduce the risk of being infected with COVID-19, and have advised the issues related to taking this disease very seriously. Tonight, we're discussing about the state of preparedness of COVID-19 vaccination. That is for the benefit of viewers and listeners just joining us to this program. And in the studios, just to remind you, I have official from the Ministry of Health, Mr. Lamin Sise, who is from the EPI. He's a senior logistician from the Ministry of Health. And on my immediate left, I have Mr. Mbai Njai, who is an EPI surveillance officer also from the Ministry of Health. Now we go further to the topic, Mr. Njai. We've spoken about the state of preparedness of the COVID-19 vaccine. We've spoken about the target groups, and we've also spoken about the vaccination strategy. I want you to give us some bit of information related to the issue of the doses. Gambia has ordered 180,000 doses, which will arrive sometime around April. Do we also expect more doses to come in the near future?
Yeah, because if you see like the 180,000 doses could only vaccinate about 90,000
exactly
people.
Because we have a population of almost 2 million.
Yeah, so and then like the COVAX facility has allocated for 20% of the population. And then this will definitely be around 480,000 people, which
of
means
the population,
that, which means that like they will definitely have to send us up to about, let's say, nearly about 900,000 doses. Okay. So it's going to be in bits and pieces, because we know that like the vaccine is not adequate so far. I mean,
of course, every country is fighting to get.
And then you see that some countries hoarding and all those things. There are a lot of control measures that are definitely taken up to ensure that like countries definitely benefit equal distribution of the vaccine to the rest of the world. So we'll definitely have more doses. And as we see, as we speak, also we have the AU, the African Union, also have allocated about 200,000 doses,
Okay.
which the World Bank
For the Gambia
for the
itself.
Gambia.
Okay.
So which means that one also will be able to vaccinate about 100,000 people. As Lamin said earlier on, we'll definitely ensure that, like, because to get maximum protection, you need to receive the 2 doses.
Exactly.
So if you receive the first dose, we'll not definitely vaccinate the 180,000 people at once.
Exactly.
Okay, we're going to target 90,000 because
Okay.
that's what they so that
At least with 2 shots for
after
each.
1 month they will definitely receive another shot.
So that means for the 90,000 is 2 shots for
Yeah,
each.
yeah,
Okay.
2 shots for each. So that's what everybody needs to be protected.
Good. I think that is very clear, and it is also very clear to clarify that Gambia is also not stopping. There are more doses to come in the near future, which is quite assuring. Mr. Sisi, I just want you to share with us your expectations from Gambians and, of course, the general population as far as the issues of the vaccination campaign is concerned.
Okay, thank you very much, Mr. Njai. I think my expectation would definitely be, I think because we know COVID is very deadly,
Exactly.
we've realized that in this country there were diseases that were equally deadly. But because of vaccination, measles, for example, a lot of children died because of contracting measles. But because of vaccination, I think this has definitely been reduced to a very, very insignificant number. If you look at it, every 4 years we do conduct measles campaigns, and we even look at a wider range. So in the Gambia, routinely, people are very receptive to immunization or vaccination. Why? What we want to tell people is that because this vaccination is coming prior to a pandemic. So we realize that, a lot of rumors also circulating around the vaccine is definitely on the way. Okay. And as we speak now, we've just done some sensitization, vaccinating the girl child on the HPV vaccine. We call it the human papilloma virus. It's targeting cervical cancer. Okay. And of recent, even as early as this morning, I saw on social media, people are even saying that the girls should not receive this, should not be receiving the vaccine at schools and other places. So expecting that, yes, Gambians will come out, but we also have an audio circulating from even a health officer who was one time a health officer trying to discourage people from getting these vaccines. But as we speak now, even if you go to our health facilities, people are taking vaccines every day. Exactly. So now vaccination is one of the most public health cost intervention form of preventing the diseases. So what I'm expecting is that once people come out, people should definitely be ready to, accept the vaccines, and we should also allow our families to get the vaccine. Okay. If you have anything that is not clear to you, seek clarification from the health officers, because we also have families. And what Mai said is very key. We will start vaccinating ourselves. Probably that will be something to people to say, yes, look, I think this is real. Otherwise, they will not vaccinate themselves to get into the trouble of if there could be any. So that's something. So I expect the Gambian population to be very, very, very cooperative. And once the vaccines are around, because these are people they will be living in. As I said, health facilities, these are the same people you've been routinely vaccinating. So they are our sisters, our mothers, our brothers, and everything. So I don't think we will just come out to, bring in something that is going to harm the population. I think my expectation now would be people will definitely be there to support the vaccination because it's the community who can definitely turn up to say, yes, this is very good. Let's
and I think ownership at this point, it's very important because the COVID-19 has affected directly or indirectly every Gambian and non-Gambian in this country, and of course throughout the world.
Absolutely. I think that's why we have the risk communication part of it, so that they will be sensitizing people about COVID. And if you have doubt, they will definitely clarify, because some people have their own reservations. Anytime there is a vaccine, you still have people who would not. During polio campaign, I give you an example. There is a community monitoring. It is family group. Anytime we have vaccination, they will not take it. Upon going there, we realize that in fact, the child received about 5 shots of polio. So we just look at it on the clinic and said, look, do you understand the vaccines on this clinic? The father said no. So we said, these are vaccines that are received, and it's polio. So he said, but I don't understand. So I think sometimes it's people's perception and how they understand. So So, but we hope, I think the communication team will do everything humanly possible to talk to people so that the uptake of the vaccine will be very high.
Good. Mr. Njai, you will want to share some views on that?
Just to add to what Lamin said, I think I'm expecting the people to be more receptive to the vaccination, because like vaccination have been ongoing in the Gambia since 1979, and then we have definitely achieved a lot. If you see that the Gambia's immunization program is one of the best in the not in the sub-region but in the whole world, and then this as a result of political commitment, human resource, and all those things, commitment, financial, and also all those things have definitely been put into the efforts to ensure that like people are protected. So this vaccination is not something different. It's just as the usual vaccinations that we used to do on annual basis, on daily basis to children, and even though the only difference is like because it's targeting another different category of target groups, but it's safe, and then people should definitely take it upon themselves to ensure that like they protect themselves against the virus, because vaccines work. But even though vaccines work, if you don't take the vaccination, if you don't take the vaccine, you will not be protected. So it will not work on you. So vaccines work, but vaccination also protects us from the disease. So please let's take the vaccines, and then it's an opportunity. Like you said that like this is going to protect me from the disease. So if I do not take it and later on, and I've been given the opportunity to take the vaccine and you have not taken it, if you get the virus, you don't have to blame anybody, you blame yourself. So please, those whom we are targeting to be vaccinated, if you are part of the priority group and then the vaccination starts, please, if you know that like there is a vaccination going around your area,
participate.
Please participate. Come out and then get the vaccine. And also encourage others also to come out, and then this will definitely help us. We definitely need to do away. The pandemic has to end. Yeah, we cannot leave.
I mean, this has disrupted all economics, and it's no joke.
So, and then like treatment is ongoing. We're also trying to see the rapid testing has been going on, but we all know that like it has not given much impact on the reduction of the disease. The only thing that we anticipate to have a positive impact on stopping the pandemic is vaccination. So that's why billions of dollars have been spent to ensure that like the vaccine is out, and then we vaccinate people so that they can be protected against the virus.
Good. Now you've spoken about getting the participation of the general population or people out there, which is very important. So the key word here for everyone is to participate. But now then, with the announcement and the discussion that we've actually made here, which is the issue of Gambia expecting vaccination underdoses, is this a room for laxity?
I will not say that it's a room for laxity. Yes, because
mind you, if some people hear the word vaccination is on its way to Gambia, people will definitely want to go back to the old ways, because we've seen when COVID was announced here sometime around March 2020, around the time, people took it so serious. In every compound, in every office, before you enter, you see buckets here and there. There were areas or times where these things were not really available. Soap and other things, detergents, were lacking, and people have to increase the price of these things because the demand were so high. But few months down the line, we've seen a sharp reduction of some of these things. Now we're talking about the announcement of vaccine coming very soon. Is this announcement also something that Gambians should take for granted and just say, you know what, let's go by our normal business? Vaccination is on its way.
Yeah, I would still advise people to continue the protective measures.
Exactly.
Even after taking the vaccination, please continue protecting people, because the virus, you can definitely carry the virus and transmit it to somebody else. So please, wearing the mask, and then also washing your hands with soap and running water, and also keeping a distance socially and physically to people would definitely improve on the protective measures that we are definitely taking. Vaccination is one of the protective measures. It's not 100% measure. So we definitely some will respond to the vaccine, some will not, and then those who do not respond to the vaccination would definitely be at risk, and then we definitely need to protect them. And there are others also. Remember that we are not targeting everybody. So we definitely continue protecting using the 3 Ws that we definitely talked about. Wash your hands, watch your distance, hands and also wear a face mask. These are definitely things that we definitely want to ensure that people continue using, even if you receive the vaccination.
Good. Thank you very much. I think that's a very important remark that you've just made. I'm just being informed that we've just few minutes to wrap up this program. But before we wrap up this program, I would just want to invite Mr. Cisse to make a closing remark.
Thank you very much, Mr. Njai. And viewers, I think we appealing to everyone. Once we have the vaccine in place, let's just try to accept the vaccine. I think, as you said, is going to complement other preventive measures that we are taking. Not everyone responds to vaccines. There could be people who will not respond immunologically. So I think there shouldn't be any room for complacency to say, as you said, yes, vaccines are out, I can do whatever. That is not helpful to the country at all. So we all know that COVID, in terms of impact-wise, has definitely destroy our economy and even the world economy. So I think let's take it seriously, and vaccines are safe to take. So we hope that we will have a very good vaccination program, because it's the same people. You know, people we are vaccinating are our own people. So I think I would want people to understand that very well.
I hope we will have a successful vaccination program. That was Mr. Lamin Cisse, senior logistician from the EPI, Ministry of Health, and of course, on my immediate left, Mr. Mbainjai from the EPI. He's a surveillance officer at the EPI unit of the Ministry of Health. Thank you, gentlemen, for coming to this important program. Viewers and listeners out there, this was your program on national sensitization on COVID-19. Synchronized on GRTS, Paradise TV, Star TV, iAfrica TV, MTA Gambia, and of course QTV Gambia, and of course on all private commercial radio stations and community radio stations. The topic we've been discussing was centered on state of preparedness of COVID-19. Earlier, we also talked about non-pharmaceutical services or measures related to COVID-19. Join us on another program on continuity of services in the health sector, another interesting and exciting program related to COVID-19. I am Momodou Njai. Till we come your way, another time, another day.
The Gambia may be the smallest country in Africa, but it will